Good afternoon, everyone. I'm Maggie Wade, and this is the Mississippi State Medical Association's COVID Town Hall. It is my honor to serve as the moderator today. The Mississippi State Medical Association has worked so closely with medical professionals and hospitals across the state of Mississippi, as well as the public, to inform and to educate about this unprecedented pandemic that we have been experiencing. And they have done a fantastic job, and that's what today is about. Today is about continuing to educate and inform, and we have an excellent group of panelists. I will introduce you to them in just a moment. Today, we're going to cover a number of topics. They include the impact of COVID on the workplace and how to best implement COVID guidelines as an employer and effectively follow through as an employee. So we all have a role to play. Access to testing and current protocols, types of treatments available and when they should be administered, what COVID looks like moving forward in Mississippi, and is the vaccine what's best for you and your family? And again, we would like to introduce our panelists. They include today Dr. Daniel Edney, Dr. Paul Byers, Dr. Jerry Weiland, Dr. Catherine Pinnell, Dr. Kim Hoover, and Dr. Hersey Davis Sullivan. And they will be talking with you more about what they do, their professions. And again, we're going to talk about some of the early treatment as well, ivermectin. We've heard so much about that. But let's begin right now hearing from our panelists, beginning with Dr. Daniel Edney.
Thank you, Maggie, and thank you to everybody who's with us today. We're always happy at the health department to join with state medical to get out good factual information to help the citizens of Mississippi make the best choices so that we can all stay safe. Dr. Byers, I'm sure, is going to share with us some excellent information where we are in this pandemic curve. This is the fifth wave that we've had to deal with. It's been the most contagious wave that we've dealt with. Thankfully, not as virulent as what we just went through in August and September with Delta, but it still had everybody's hands full, especially our hospital systems. I'm going to share with you, where we are in terms of therapeutics. And it seems like every wave that we've been through, we've had a different set of tools to deal with. I'm a practicing clinician in Vicksburg, general internal medicine. I'm also the chief medical officer for the Mississippi State Department of Health. So I'm looking through both lenses at what's going on. And as a physician treating COVID patients, we've gone from having no tools except social distancing and masking through different iterations of monoclonal antibodies to where we are today. And today, we do have two monoclonal antibody treatments, sotrovimab, which is for the general population based on your level of severity of illness and your risk factors, but it's a very tight supply. Mississippi gets a very small amount every week. We've been getting 400 to 500 doses a week for the whole state, so that's difficult to come by. But we also have Evusheld, which is a monoclonal antibody combination that we're using for immunocompromised patients, those who are going through chemotherapy and solid organ transplants, especially, and who are on immunocompromising medications. This is a preventive medicine that you can get from the cancer centers and the transplant centers that will give artificial immunity for 6 months. And we at the health department are wanting to push that information out. That is available for our patients that are at the highest risk and a very important tool. Thankfully, we do have antivirals, the medications that actually attack the virus. Remdesivir that we've had from the beginning has been shown to be highly effective in the outpatient setting. Earlier in treatment, we were just using it in the inpatients for those who were sicker, but we're seeing that it actually works extremely well, really to the same level as monoclonal antibody treatments, with 80% of effectiveness in reducing hospitalizations and death. That's a 3-day IV infusion, and your healthcare provider will know about this and will know how to access that for you if that's needed. And then we have two medications that are oral medications. You may be familiar with Tamiflu, Maggie, that we use for influenza. We have two medications that are also oral, that are antiviral, that are actually inhibiting the replication of the virus and causing its death. That's Paxlovid, which is highly effective, again, 80% effective, reducing hospitalizations and death. It's tighter supply than the other medication, molnupiravir, that we have, but the supply is increasing. And if you go to the Health Department's website, msdh.gov, we can direct you where you can get these different therapeutics. But the big news is that molnupiravir, although it's less effective, is more widely available, and now is available in our Kroger pharmacies around the state, and should be in Walmart, if not already, then very soon, so that physicians and providers can actually prescribe that to the local pharmacies, and you'll have access in your communities for that antiviral medication. So, but always remember, our best tool in fighting COVID are vaccinations. The vaccinations are effective against Omicron. The boosters are very important against Omicron. They reduce hospitalizations and death very effectively. So if you've not had your vaccination, please get it. They are safe, they're widely available, they're free. If you've not been boosted yet and you're due, it's very important that your booster will improve your outcome should you get COVID. It may not keep you from getting Omicron, but it sure can keep you out of the hospital. I know that's what Kim Hoover wants. So glad to be with y'all today. Thank you.
Dr. Edney, thank you so much. We'll move on now to Dr. Paul Byers.
Hey, good afternoon, everybody. And just as Dr. Edney said, thank y'all for the opportunity. I think this is an important time for us to continue to connect and improve awareness. As y'all have been watching, and it's been a tough couple of years for the United States and for Mississippi in particular. It's hard to imagine sometimes that it has been now almost a full 2 years since our first case that we identified back in 2020. And as Dr. Edney indicated, we have been in our fifth wave, and the toll has been pretty significant for Mississippians. We've had over 11,000 deaths that have occurred. Now, looking at what our current epidemiological data is, demonstrates that we are in some downward trends right now in case numbers. And that's good, and that's encouraging, and we expected that. One of the things that we have not seen with the current wave that we're in that's been due to Omicron, which is the new variant that we identified in Mississippi in the United States later in 2021, is the significant impact on deaths. But that does not mean that we've not had a lot of deaths in Mississippi due to Omicron. Certainly they've been less than what we saw with Delta, especially when you look at the staggering number of cases we've had with Omicron, as Dr. Edney indicated, which is significantly more infectious, more easy to transmit than the previous variants that we saw before. So we've had a lot of cases. In January alone, we had over 170,000 cases that were reported to the Department of Health, but the deaths have not been as dramatic as we saw in the Delta wave or in previous waves. We are reporting out a whole lot of deaths today. And I anticipate that we are going to continue to see high numbers of deaths over the coming several days. It's very difficult to see the number of cases that we've seen and not have an impact on our vulnerable population. And when you look at the individuals who make up most of those deaths in Mississippi, it's our older population. It's folks primarily over the age of 50, especially over the age of 65. When we drill down a little bit more and look at who are the people that are dying in Mississippi, the majority of those deaths are still occurring in people who are unvaccinated, or in people who may have been fully vaccinated, but have not received the booster. And, that tells us the importance of the booster, especially for our vulnerable population. Individuals who are over the age of 65, folks who have underlying chronic medical problems, individuals who are at higher risk for severe outcomes and hospitalizations. But when we look overall, it's not just our case numbers that are coming down, and our deaths are slowly coming down when we look at the trends. We're seeing other indicators that tell us that we're on the back end of this current wave. We're seeing less emergency department visits for COVID. We're seeing less demand for testing, and we do have widely available testing throughout many parts of the state. We're seeing decreased impact in our nursing homes as far as nursing home outbreaks. And so these are all positive indicators that we're moving in the right direction. But it's important for us also to understand that we have learned a good bit about COVID and how it's transmitted and how to protect from it over these last couple of years. It's not just the general population that we've seen affected, but it's also very specific groups. We've had a significant impact on our schools over the last couple of years. A lot of cases have been reported in schools, a lot of outbreaks, and in some circumstances, we've had a number of schools that have had to have temporary closures or temporary dismissals and go virtual. Excuse me. Fortunately, we are seeing some decreases in the number of cases in school children as well. But it's also important, and I know Dr. Weiland and others will talk about this later as well, the impact that we've seen on the children and the importance of having children vaccinated as well. We've had 11 pediatric deaths in the state so far during this pandemic, and those children have not been vaccinated. Understandably, many of them were not eligible either by their current age or the vaccine wasn't available at the time of death for their age group, but many of them were eligible for vaccination. And so it's important for us to continue to move forward with vaccines, especially for kids. Sorry, I'm trying not to sneeze here, guys. And also looking forward, what we've seen impact on businesses, we've seen impact on industries, especially early on, but we've learned more now. And the keys to protecting yourself in the workplace, the keys to protecting yourself at school, the keys to protecting yourself wherever you go is we have high community transmission through all parts of the state right now. It's important to wear a mask. It's important to get vaccinated. Wear a mask when you're in public settings, especially if you're not up to date with your vaccines, but especially get up to date with your vaccines. Physical distancing. Don't go to work if you're sick. Don't let your kids go to school if they're sick. These are not new concepts, but it's important for us to continue to reiterate these things. These are how we protect ourselves, and these are how we protect the community. Because remember that a lot of folks who get COVID may have a mild infection. It may not impact them. A lot of kids may get infected, may have a mild infection, but they can be the source of transmission to those other folks that can really impact them, especially vulnerable people who can have some severe outcomes. We have been through a lot as a state, and we have done a lot together as a state in these last couple of years, but we still have work to do. We're just at 50% of our total population vaccinated. We have a bit over 30% of our total eligible population have received boosters. So these are all things that we need to continue to work on. And I think in the coming months, we may continue to see surges of COVID, but we know the things to put in place to prevent transmission. And with that, I'm going to turn it over because apparently I have to have some water.
Thank you, Dr. Byers. And Dr. Byers is our state epidemiologist. I know all about allergies, believe me, most of us do, especially this time of year. Right now, we're going to hear from Dr. Jerry Weiland.
Thank you, Maggie. I'm Jerry Weiland. I'm a pediatrician in Vicksburg, Mississippi, and I've been in practice here since 1983. I currently serve as the president of the Mississippi State Medical Association, so I thank you all for attending this. I wanted to take a look at this from a pediatrician's standpoint. There's no doubt that this COVID pandemic has affected everyone in every age group, people in the healthcare profession, people in general. But I want you to kind of look at it from my point of view for just a few minutes. We were somewhat fortunate in pediatrics initially. The initial variants were not overly infectious to children. So I kind of sat back and watched my adult doctors have to deal with some really horrendous things, like losing a lot of our older Mississippians. I was excited when the vaccine came out in December of 2020. Unfortunately, at the time, it was only available to folks 16 and above. So that left most of my population without even the ability to get vaccinated. Even so, like I said, I found it a little bit exciting because those people over age 65 and those young adults and people over age 16 who felt they had underlying health issues did go out and get vaccinated. That left a lot of people who were healthy and didn't feel that they needed to get vaccinated. But the numbers went down tremendously in the spring of 2021, and it looked good. And then we hit the summer of 2021 when the Delta variant came along. About the same time, Pfizer's vaccine became available for children 12 and above, but it came the same time as the Delta variant, which was extremely deadly and really had a disastrous effect on children. Started getting sick more than they had been before. Young adults got sick. We lost people because most of them were not, the people we lost were not vaccinated, but this included otherwise healthy young adults, healthy young parents. Even had 2 moms that had to deliver their babies while they were on a ventilator, and one of them was able to survive and one was not. I mean, these were serious issues. The 12 and above happened at the end of the summer 2021, and this past October, children ages 5 to 11 are candidates for the vaccine. They receive a third of the dose. They don't receive the full dose, and a third of the dose in 2 shots about 3 weeks apart. We just really, I want people to know that the vaccines do help. What we have seen in the pediatric population is those children that are being hospitalized are not vaccinated. The Omicron started being a problem in December of 2021. In the middle of December, just before Christmas, in 2021, there were absolutely no admissions to the Children's Hospital with COVID. By New Year's, that number increased to about 12 to 15, and it's been hanging between 15 to 20 on a daily basis of children with COVID that are admitted to the Children's Hospital, with about 2 to 3 children on ventilators. These children were either too young to be vaccinated, which means they were less than age 5, or they weren't vaccinated. This is a disease of opportunity for people who are not vaccinated. I think it's important to do this. These children are better than we adults. When I give these shots to these vaccines to children, they're not bothered at all. Where sometimes we adults moan about how bad we feel for a few days and gosh, this is the worst thing since, I don't know, my flu vaccine. But I think it's important to realize that this has been a really sad event for children, for young adults, and it's preventable. I want to see my patients smile again. I want to see their smile. I want them to see mine. We get there by getting vaccinated. Thank you, Maggie.
Thank you so much, Dr. Weiland. And at this time, and I have to apologize because I use every single syllable, and she's a friend, Dr. Catherine Panel, and she will speak to us now. Thank you so much, Dr. Panel.
Thank you, Maggie, and thanks everybody for joining and having me today. My name is Catherine Panel. I am a psychiatrist. I practice in Madison and Oxford. I'm also the medical director of Right Track Medical Group and chair of the board of the Mississippi State Medical Association. And just to echo what everyone has already said, the past 2 years have been very difficult and they've been very hard, but not just from a physical standpoint. It's also been very difficult for everyone mentally. And I think sometimes mental health gets overlooked. One of the few things that's positive about the COVID pandemic is we have started having those necessary conversations about mental health and mental health care, whereas we weren't talking about it much before, but we still have a long way to go in talking about mental health care. Depression rates, anxiety rates, substance abuse is on the rise, all due to the stressors that have come from the pandemic. So we have to keep talking about it, having those needed conversations so that we can reduce the stigma. So again, Maggie, thank y'all for having me today to have those necessary conversations.
Dr. Panel, thank you so much. And now we'll hear from Dr. Kim Hoover.
Thank you for the opportunity to serve on this panel today. So we've had the perspectives from our colleagues at the State Department of Health and others, and I was asked to talk a little bit about hospitals, but in particular about nursing in hospitals. And so, as you know, hospitals have been at the forefront of the pandemic response. As the Chief Operating Officer for the Mississippi Hospital Association, I've had the opportunity to be on weekly calls with our chief nursing officers across the state. And so it's given me a good deal of insight. I'm also a nurse, but this has really given me a lot of insight into what's been happening. So as I said, the hospitals have been at the forefront of the pandemic response. They have been taking care of patients, not only COVID patients, but they've been taking care of all of the patients who typically need to come into the hospital. They were available to give vaccines. They stood up clinics to administer monoclonal antibodies in addition to the other types of normal things that you would do. And when we started, when this pandemic started 2 years ago, initially there was enough nursing staff to provide the care that was needed. However, with each surge that has occurred, Mississippi hospitals have lost more nurses. And in particular, we are now to the point that there are hospital beds available, but they're not staffed. And so nurses, as much as anyone else, are asking people to please do everything that you can to protect yourself and to protect your loved ones. Typically in hospitals, not just in Mississippi, but across the United States, about 60% of the registered nurses in the state work in hospitals, list hospitals as their place of employment. Over the last few years, that has been reduced by a third to about 40% of the hospitals. There are a number of other opportunities for nurses. Services have moved out of the hospitals and into the communities where there are ambulatory care centers and surgical centers and that sort of thing. So we were already down some in numbers. Right now, we have over 3,000 RN vacancies just in hospitals alone. And if you take that in combination with the other workers in hospitals who are not there, there are people in environmental services and dietary and nutrition, in housekeeping, respiratory therapy, and others who aren't there as well. And so there is a lot of care that is really falling to the RN. Initially, when there were enough nurses and the pandemic was hitting other states worse than it was hitting Mississippi, travel agencies began recruiting in Mississippi so that nurses could go to other states and help handle those situations. And they were paying really, really high wages. And so obviously if someone's trying to pay off their student loans or they're paying off their mortgages, kids' education, that's really quite lucrative. When that began to hit the state of Mississippi, those nurses didn't come back to Mississippi. When they did come back to Mississippi, they were working for the travel agencies and not the hospitals. So travel agencies recruited Mississippi nurses to work in Mississippi. Over time, some nurses simply said, I cannot do this anymore. You heard the discussion about mental health and well-being. When you have been at that grind 24/7, caring for people who are dying without their families there, it takes a toll on you. And so we've had nurses who retired early. We had nurses who simply quit nursing and said, I can't do this anymore. And others who are taking a break or going into other roles. And so what we have then are a situation where hospitals were able to stand up more beds when it was needed. We could create more ICU beds. We could handle more people in the emergency department. At this point now, we are not only able to, we can't open more beds, we can't staff the beds that we have. And there's about a 25 to 30% call-in rate. So while we all hear about schools that have outbreaks of COVID and businesses that have problems with that, well, it happens in hospitals too. So nurses and others are exposed to COVID, their children are exposed to it. Sometimes they simply get sick. There's not a lot of vacation being taken right now, but if you think about 25% of your staff at any given time calling in, then maybe on a daily basis, ICU beds have to be decreased, or you can't take as many people in the emergency department as you could. And so we might go into the emergency department for something that means we have to go to another part of the state, or possibly even be transferred to another state. And so the situation is pretty dire, and in particular around nursing. There's not a quick fix for it. We certainly want to recruit people into nursing along with other healthcare professions, but particularly those working in hospitals. But that's going to take 3 or 4 years for those to be the next group of nurses who are coming out. So lots of things that we've been thinking about, whether it's virtual admissions and discharges from some of those great nurses who decided to go home, and maybe they're willing to come back and do some things. So I'll leave it at that, Maggie, and we'll go on into questions, and maybe I can answer some questions. Thank you.
Thank you so much, Dr. Hoover. And now Dr. Hersey Davis Sullivan.
Good afternoon. My name is Dr. Hersey Davis Sullivan. I'm a family physician in the city of Jackson in private practice. I am also president of the Mississippi Medical and Surgical Association, which is the NMA branch for the state of Mississippi. And thank you all again for allowing me to participate in this town hall. I think it's a much needed venture. The more often we can speak to the people we take care of in a way and on a platform that allows them to ask us those burning questions that may or may not be keeping them from making a decision to get a vaccine, I think the better we position our state to be healthier, which is absolutely what we want as clinicians, as those advocates for people in the state of Mississippi, whether we're serving in private practice or in the hospital setting. Our ultimate goal is to take care of the citizens of the state of Mississippi. Some of the things that I encounter in private practice often has to do with hesitancy in terms of vaccinations at this point. A lot of my patients that are currently coming into the clinic have been vaccinated and boosted, but there are still those individuals who are saying to me that they have not been vaccinated. And at this juncture, they're not planning to. And oftentimes when I ask why, I get a variety of answers. And I do my best to address those issues honestly, truthfully, because as a clinician, I'm here to sort of help you make the best possible healthcare decision, not to make you make a decision, but to be a resource so that you can make the best possible healthcare choice for you and your family and other Mississippians.
Thank you so much, Dr. Davis Sullivan. We've got quite a few questions coming in already, and I won't direct this to anyone, but we're getting a lot of questions about ivermectin. Is it effective as an early treatment, and would you recommend it? So anyone who wants to, we'll start with that.
Well, Maggie, since I was dealing with the therapeutics, I'll be happy to deal with that. As a practicing physician who was seeing COVID patients in the hospital before we had vaccines, I was anxious for us to have anything. We had no medicines, we had no vaccine. We just had our protective gear to protect us. And I was so anxious for there to be something to work. So when hydroxychloroquine showed some early promise, we truly wanted it to work. But as the larger studies went forward, it just showed no benefit. And the same thing with ivermectin. It showed a glimmer of hope in the initial case reports, but as appropriate medical studies were done, it just did not pan out to be effective. And as a physician, prescribing therapeutics, I have to restrict my practice patterns to those things that are proven safe and effective. And so that whole long list of medications that I gave at the beginning are all they're all effective and they're safe when prescribed appropriately. All of them can have side effects and drug-drug interactions, but that's the job of your healthcare provider to work through that. But we do have good access to therapeutics that are proven to be effective. And molnupiravir probably has the widest access. Again, that's the one that's in Kroger and Walmart that your doctor can prescribe for. So as a physician and as someone who's not had COVID yet, but if I do get COVID, I'm going to choose something that's proven to be effective. And that's the list of therapeutics I gave you at the beginning.
Maggie, I just wanted to add something to what Dr. Edney was saying. There are some things available, but as a pediatrician, I wanted to remind the folks listening in that very few of them are available to children, and most of those are available only to children over age 12. So therefore, I'm a big fan of the vaccine because that's really about the best tool that you have for your children, especially ages 5 and above.
Thank you both so much. This is a question: how effective is the third vaccine? And they're asking if a second booster might be necessary, and that they're hearing a lot about that.
Yeah, and I can help answer that question. So, right now there is a third vaccine or a booster dose that is recommended for individuals who have completed that primary series, and preferentially now we're recommending the mRNA vaccines that we've heard so much about now, the Pfizer and Moderna vaccines. And if you look at the data, the booster dose is over 80% effective, depending on the study, in preventing those severe outcomes, hospitalizations, preventing deaths. And that's the important goal that we're trying to do with the booster dose. After that primary series, that immunity may wane, and your protection against COVID infection may be reduced over time. And that booster dose helps boost your immune system so that you have some further protection, not only protection from infection itself, but also from the severe outcomes that can occur. Now, there is a third dose of vaccine that can be recommended as part of that primary series for immunocompromised folks, for people who have had transplants and are on medications to help them not reject that transplanted organ, individuals who have cancer and undergoing those treatments that might make them immunocompromised or immunosuppressed. And that third dose in that primary series is to help get them the immunity that they need. And after that third dose in the primary series, it is recommended to get a booster dose on top of that. So for those individuals, they would have 4 doses of COVID vaccine, as long as they got that dose at 5 months after that third dose. And it does show that improved protection. What we're seeing over time is that vaccine or even prior infection with COVID may not be as effective at preventing you from becoming infected, but it does prevent those severe outcomes that can occur as a result of infection, especially in the vulnerable population. We know that we're going to have infections. We know that we're going to have transmission. We know that we're going to have infections that occur among vaccinated individuals. That's not unexpected. But what we're trying to do is reduce those severe outcomes, reduce the hospitalizations, and reduce those deaths, especially among our vulnerable population.
Thank you, Dr. Byers. Now, this question is about the shots. The shots are causing injuries and deaths. I was told by my oncology nurse that there has been a huge uptick in cancer diagnosis and recurrence. And so we'd like to ask our panel to address this, as well as you, Dr. Panel, because there is so much confusion. There's a lot of anxiety. People are afraid. And that has a lot to do with their mental health as well, because they're afraid and just want the information. So anyone want to jump in on this?
Well, and I can start, and I'll just kind of share how we monitor adverse events that may occur as a result of a vaccination. And this is not new or different for a COVID vaccine. This is a system that's been in place for a number of years, and it's the Vaccine Adverse Event Reporting System. And this system is designed to potentially identify those severe or adverse events that may occur as a result of a vaccination. And it's actually quite a large system that's run through the Centers for Disease Control and Prevention. And certainly we have direct access to that data and monitor it frequently. And it's a system where individuals who think that they may have had an adverse event that occurred as a result of a vaccination, including COVID vaccines, or a physician may directly report to that system, about what the adverse event is. And we do monitor that system. And this was a system that works, and it's how we were able to identify that there was an increased risk of inflammation of the heart tissue or heart muscle in some adolescents, especially young males, after receiving the mRNA vaccinations. And certainly we made individuals aware of that. It's also a system that worked to identify the severe clotting problems that can occur with Johnson & Johnson that were identified and made public. And so it's a system that's designed to be sensitive to identify those recurring sort of severe or adverse events that may occur as a result of vaccine. And so we monitor that system closely. And that, again, is a system that's been in place. There are also other systems that we encourage individuals to use after you get a vaccine, and that's to sign up for the VSafe program through CDC. And it's actually a health checker to monitor your health after you receive the vaccine. And so these are some of the tools that we use to look for these adverse or problems that can occur with a vaccine like the COVID vaccine.
Dr. Panel, did you want to add anything to that? Because again, some of the questions that are coming in are about them dealing with this and just having anxiety.
Right. I mean, that's a normal part. Anxiety is a normal part of life. We get anxiety with any shots that we get, but we need to trust the experts and follow the science. And right now the science is showing that vaccines are in fact safe and that they reduce hospitalization and death. So we trust physicians with all of our other care. We need to trust them in this as well.
Maggie, I'd like to point out that in terms of safety, that over 97% of America's physicians have voluntarily chosen to be vaccinated. That's not based on mandates. That's not based on anything other than making our own informed choices. And so physicians all over the country, like myself, we are vaccinated, our families are vaccinated, and we are here to say, they are safe, they're effective, they are making a difference, helping us get through this pandemic, especially protecting our hospitals and reducing the numbers of deaths. Had Omicron been as deadly as the Delta variant, we would be dealing with an apocalyptic situation right now. But thank God it was not.
May I say something though about Omicron as far as in children? Dr. Edney is correct. The Delta variant, which had a more significant effect on the lungs and giving people pneumonia and that sort of thing, and was deadly. We had problems with children. The adults are having a little less problem with Omicron, but it is an it's more of an upper respiratory infection, which is great for adults. But if you think about it, adults, your large airway is about at least as big around as my thumb. And in children, their largest airway is only as big as the bottom of their little finger, not mine, their little finger. So they have more airway compromise. We're seeing more croup-like problems. We're seeing problems in little babies because they have that mechanical issue with their airways. And, you know, as I mentioned before, you know, we don't have all of the tools that you have for adults. And again, less than age 5, we don't have a vaccine available. So it would be great if those siblings aged 5 and above were vaccinated. Thank you.
Thanks so much, Dr. Weiland. This is a question, and it says, can a cancer patient in remission receive the new COVID preventative meds that Dr. Edney mentioned?
Yes, Maggie, we would leave that to the discretion of her oncologist, but we would support her oncologist's decision based on what her needs as a patient are. So I would encourage her to talk to her doctor about it.
Anyone else? Okay, the next
No,
question.
other than to just add that, you know, that's the candidate. That's the type of individual that should speak with their physician. If you're undergoing cancer treatment, if you've had a transplant, if you have moderate to severe immunocompromising conditions, talk to your physician about the possibility of that medication.
Our next question, as we hopefully begin to come out of the pandemic, what are some of the big lessons for our state? Do you think we'll actually learn them?
Well, I think one of the big lessons is that, you know, when we pull together, we can accomplish remarkable things. And I think, you know, in a lot of respects, we've had great buy-in, and we've really worked closely with our schools. Our school systems have done a pretty remarkable job in the state of really applying the guidance to the best of their abilities to keep children in school, to keep children in person learning. And I think, you know, one of the remarkable things that has developed out of the pandemic and the pandemic response is those connections that we have made, not only with the community, but with certain groups like schools, like certain industries. Certainly our relationship from the health department standpoint is stronger with state medical than it's been. I think, you know, our relationship with the hospitals and with planning and response is strong. And I think it demonstrates that we can continue these efforts and not only work to address things like the pandemic, but to address other health-related aspects that need attention.
We have 2 questions here. How do we know that we have an Omicron variant? And do the infants born to mothers who have been vaccinated have immunity when they are born?
Well, I can answer the first part, and then I'll let smarter people than me answer the second part. So the first part about how do we know that we have the Omicron variant in Mississippi? So we have a system of surveillance where we work to identify the types of COVID-19 strains or SARS-CoV-2 strains that are circulating in the state. And we do this through collecting samples in our community testing, but also through partners that we have with other labs to sequence selected samples to look for things like the Omicron variant or the Delta variant, or even emerging variants down the road. And so this is a system that we work with in our public health lab, that we work closely with the University of Mississippi Medical Center lab to identify the strains that are currently circulating in the state. and causing illness. And, we do this all the time. Right now, virtually 100% of the samples that are being sequenced are Omicron. It wasn't that way a couple of months ago. But we do the sequencing all the time. And even when we're identifying that it's all one variant type, so we can continue to stay up to date and look for the emerging next variant that's out there.
I'd like to take the second part of that, if that's okay, Maggie. As a pediatrician, I do work with moms. I work with pregnant moms. I've mentioned to you how difficult the summer was in the fall because we had a lot of pregnant moms get sick. At the time, there was not a big push to have pregnant moms and ladies who wanted to become pregnant get vaccinated, but there is a bigger push now. The great news is those antibodies that mom makes when she gets the vaccine are transmitted over to the unborn baby and can protect the baby in the first few months of their life, which is fantastic because again, those babies are born with such small airways. Secondly, if the mom is breastfeeding and has been vaccinated, she will give some protection through her breast milk to her baby.
Thank you very much. This question is from one of the viewers on Facebook. What has happened to the free N95 mask that were supposed to be distributed to every county in person? My county has gotten 0, but people in Jackson have said they were getting them.
I know that N95 masks are being distributed to select FQHCs and to pharmacies throughout the state. I'm not certain if that's the program that the individual is talking about or not.
Okay. This question, I'd be interested in hearing the doctor's comment on current mask wearing guidance. Specifically, is the current guidance to wear N95, KN95 mask and not cloth mask?
Yes, that is the current guideline. Preferably N95. If you don't have access to that, then a KN95 cloth mask. If you have nothing else, certainly, if you can provide yourself with something that's better than nothing, but N95s and KN95s are the premier choices.
Dr. Panel, this is a question for you. We've seen an increase in suicides. There's more isolation. Now with deaths and families continuing to deal with grief, what are your suggestions?
Thank you for that question. It's a really great question. Not only are we seeing increased rates of depression, suicide, substance use, but also PTSD in healthcare workers has been on the rise. And it's a very difficult time. People have lost jobs, they've lost loved ones, big stressors. And the best thing to do is to seek help. We're talking about it more. Seek help from your mental health centers. Do therapy if that's not enough. The gold standard of treatment is therapy and medications, but communication is so important. And we do need to eventually get out of this pandemic. I mean, that's the ultimate goal, and that's going to be through getting vaccinations.
Thank you so much, Dr. Panel. Here's a question from Facebook. Will we be back to normal by Mardi Gras, the month of March? What role did Mardi Gras celebrations have in the initial outbreak in 2020?
Isn't that a great question? And what's the definition of normal, right? I think we're going to be in a better place. I think, our case counts are certainly trending down. Our disease burden is trending down. I think it'll be an opportunity for us to continue to exercise the recommendations that we've been talking about, to make sure that for those folks that haven't been vaccinated, that are interested in getting vaccinated, talk to your doctor, and certainly if you're on board, go ahead and get those vaccines, and we certainly encourage it. But I think we did see, and certainly many of you remember that Mardi Gras back in 2020 when we first started was sort of one of the initial niduses or focuses of infection and transmission. And certainly New Orleans was hit hard, and we had a lot of folks who had attended Mardi Gras and Mardi Gras parades and parties that were infected. And certainly we feel like that contributed some to the initial transmission that we saw once it took a foothold in Mississippi. I think, we need to sort of look at our expectations over the coming next months. And we anticipate that there's still going to be transmission of COVID. Even when we have downward trends, we're still going to be able to identify COVID transmission in the state and in the United States. And there are going to be periods of time where we may have increases in COVID transmission that result in more cases and potentially more pressure on the hospital. And I think, it's important for us to be aware of that, whether it's due to a new variant or whether it's not. And so we have opportunities, and we continue to have opportunities that present themselves to put in play those things that we know can ultimately prevent transmission.
Maggie, may I add a little something about Mardi Gras specifically? If we're talking about big Mardi Gras, which of course is New Orleans, which of course is close to Mississippi, I am a member of a crew of Mardi Gras, and the requirements this year for every rider in Mardi Gras, every person who is going to get on a float, is that they are vaccinated or have a negative test within 72 hours of getting on the float. There are no exceptions to the rule. If you do not have the test or you're not vaccinated, you don't get on the float. So there's a good chance that if you pick up COVID at Mardi Gras, it's going to be being in the crowd, not because of something someone threw to you.
Thank you both. Dr. Hoover, this is probably a question for you. This question, and it's a statement: in the mandates, and you will have nurses and workers end weekly testing for unvaccinated. I guess it's more of a statement than a question. It said, if you end the mandates, you'll have nurses and workers end weekly testing for the unvaccinated.
So most of, at this point, most of the staff is actually vaccinated in hospitals. At the federal level, that is a mandate that's obviously going through. There have been states that oppose that. We have had some hospitals that went through with the vaccine mandate before there was anything at the federal level. We're seeing more workers leave. Ultimately, most of those are simply getting the vaccines and they're staying on. We're seeing more workers leave for higher wages at Target or at Wendy's, positions where they can make either as much or more money and not have to undergo the stress of working in the hospital right now, to be quite honest with you.
Thank you, Dr. Hoover. This question: this vaccine just caused a good friend to have a stroke just last week. Strokes are everywhere and they are hiding it. Docs and hospital deny vaccine as cause, while nurses hinting to patient that it was the shot, and nurses say they've had strokes coming in droves. How do these doctors address this, I guess would be the best way to put this.
Well, and I think I covered how we monitor adverse events. What I would encourage folks, just like we encourage doctors to do, that if you've had an adverse event, if you think it's related, even if you don't know that it's potentially related to the vaccine, please report it through that vaccine adverse events reporting system. Again, that's a system that the public can report to. It's a system that physicians can report to. And that's how we know if there are potential adverse events. To date, we have not seen increases in strokes related to the COVID vaccine. We haven't seen it. However, I would encourage anybody who thinks that they've had an adverse event to report it or to have your physician report it.
I like Dr. David Sullivan's viewpoint. I can tell you, as a physician who takes care of older patients and takes care of strokes, I'm not seeing any change in numbers of strokes or severity of strokes. It's the same numbers we've always had. We're not seeing strokes in droves. That would be very obvious to everybody in the healthcare system. And personally, as a physician, I certainly wouldn't be taking the boosters and having my whole family vaccinated and boosted, including my grandchildren, if I were seeing that. There is absolutely no incentive. There's no reason for any of us to be trying to cover up such a thing. Our job is just the opposite. We are here to defend the public health. So, Dr. David Sullivan, that's what you're seeing.
Absolutely. And I agree with you, Dr. Eddie. That was the point I was going to try and make, that as a healthcare provider, it doesn't make any sense to lie to your patient or to hide information. It is ethically wrong. And I mean, it's just not humane. So having taken care of people for almost 30 years, I too haven't seen the things that person asked the question about. What I have seen is that because we have such a preponderance of this virus in our country, we're having delays in medications, we're having decreased access to healthcare for any number of reasons. Those things may be contributing to some increases in poor healthcare outcomes, even in the instance where some individuals may not be getting the routine care that they would normally get for cancer or for their hypertension or for their diabetes, has less to do with perhaps a vaccine than it does just the state of affairs currently.
Okay, this question, if they're all vaxxed up, how would they get sick after all those boosters?
Keep in mind that these vaccines are 93% effective. So if 94% of people, if it's effective in 94% of individuals, there's a 6 to 7% of individuals who remain at an increased risk. So nothing is 100%. We wish it were. I wish we could give each other something that would keep us 100% safe, but unfortunately that doesn't exist. And for what we do have, I am grateful because we're at least able to provide some level of security for patients and individuals. And, you know, that's sort of just the state of things. We don't have anything that's 100%. I wish we did.
And the other thing that people need to remember is that, you know, when the vaccines became available, and people took them, we still had a lot of people who were not vaccinated who were incubators for this virus to mutate. This virus wants to mutate. It has mutated. It probably will continue to mutate. What we learned with Omicron is that it had a lot of different, it was significantly different than the Delta. And I think it's fantastic that we do see that the vaccine, even though the virus has mutated, still protects you. Yes, you may, if you're vaccinated, you may get the Omicron variant of COVID, but you're not going to get that sick, and you're not likely to end up in the hospital, and you're not likely to have intensive care.
I think what's important for our patients and other individuals to know is that the vaccine bolsters your immune system to fight against exposure to this virus, so that, you know, depending on what underlying conditions may exist in your life health, what other situations socioeconomically may be a part of your development, those factors also play a role in this process. The vaccine is a tool that we have that aids us in hopefully decreasing morbidity and mortality from this virus.
This question, why after 2 years have we not spent more time on early prophylactics versus forcing the shots?
I would like to just talk about that just a little bit. Early prophylactics, you have to do it early. Even Tamiflu can be effective against the flu, but you have to start it within 48 hours because what it does is it reduces the replication of the virus. People don't understand. They think you can take something like Tamiflu and it will cure you. No, what you're trying to do is you're trying to reduce your viral load. If you already have a very huge viral load, you're going to be sick. And I think we know that there have been medicines developed. Dr. Edney went through that, and there will continue to be medicines developed. But even if we were to correlate this to influenza, you still are better off taking a flu vaccine and then using an antiviral if you need it than just waiting to get the flu and hoping that you get an antiviral in time.
Yeah, and it makes a whole lot more sense to receive a vaccine that actually gets your immune system to protect you from that infection rather than a prophylaxis that you have to take long term. And I think, as we move forward, and Dr. Weiland mentioned Tamiflu, I think we will see the emergence of oral prophylactic medications that can be utilized in the event of an exposure to help provide some additional protection, much like we see with influenza.
And also keeping in mind that this was a novel virus. It's not to say that those efforts were not in place. It's just how things sort of rolled out. And so this is where we are. Instead of complaining about what we have, why not utilize what we have and make the best of it so that we can minimize the negative impact of this disease on our communities?
And this is more of a statement as an immunocompromised person and solid organ transplant patient. I applaud and respect everyone who has taken the appropriate steps to be vaccinated to protect those of us who are not able to mount antibodies and those who cannot medically receive the COVID-19 vaccine. I especially thank healthcare workers and medical professionals who look out for their families and patients alike. Would anyone like to respond to that?
I mean, thank you so much. And that's such an important point too, because, one of the things that when we think about when you're vaccinated, not only are you protecting yourself, but you're protecting those individuals around you, especially the people who may not be able to mount an appropriate immune response, or individuals who may not be able to receive the vaccine for whatever reasons. And so I think, not only are we're doing ourselves a favor when we get vaccinated, but those individuals around us.
Which also includes all children less than age 5.
And please talk to your doctor about EvuShield. Sounds like you're a perfect candidate for it.
And I just want to say thank you for the positive remarks and comments. Like Dr. Hoover was saying, nurses and physicians and all healthcare workers are so burnt out right now. So it's nice to hear positive comments, because I know right now we're having to defend vaccines, and doctors are becoming the villains. And initially we were the superheroes at the beginning of the pandemic, and now we've turned into the bad guys. So it's so nice to hear positive comments and remarks, and that's what keeps us going and working together to keep you safe.
And I'd like to address a myth of sort. A lot of patients will say, I'm too sick to get the vaccine, or I have too many health problems to get the vaccine. Just as Dr. Beyer said earlier, those individuals are prime candidates. We want everyone to get it, but certainly those individuals with the comorbidities, with health problems, are those people. Please talk to your physician about why this may be a better choice for you than not taking the vaccine.
Thank you all so much. What about breakthrough infections? I am seeing a lot of people who are double or triple vaccinated. They're still able to catch and spread. How is the vaccine the standard if it does not stop the spread?
Well, we just talked about that just a little bit. And I think what people have to understand is, first off, this virus has mutated to where the vaccines help, but do not completely prevent you getting and spreading it. But you have to remember, especially with respiratory vaccines, again, like COVID-19 and influenza, your vaccine is a shield, not a force field. You can still get sick. You're just not likely to get sick as often as someone who's not vaccinated, and not likely to get as sick.
And this.
And I would just like to add to that, when we talk about the vaccine, we're talking about one of the strongest layers of protection. But it's important that we avail ourselves to all layers of protection. And that includes wearing the mask when appropriate. It includes physical distancing. It includes avoiding those groups or taking special precautions in large groups where transmission is likely to occur. It's all about doing the best protection that we can. And the vaccine is like wearing a seatbelt. You don't get in the car without a seatbelt, and that's that additional protection.
Dr. Pennell, there's also a question about teeth grinding. Many people, even though they seem like they're okay, a lot of dentists are reporting they're seeing a lot of people who've never done it before, which is an indicator of what's going on with them mentally.
Yeah, I mean, a lot of it, we're seeing a big increase in anxiety, and we harbor a lot of tension in our jaws and in our necks. We're tense, we clench. So that does not surprise me, but that's where self-care comes in and healthy coping mechanisms. You've got to take care of yourself, go for walks, journal, eat healthy, do things outside, take care of yourself.
Thank you so much. Are vaccines and boosters safe for pregnant women? Has there been or have there been any studies?
Maggie, the American College of Obstetricians and Gynecologists recommend vaccination at all stages of pregnancy and for breastfeeding moms. And we cannot do prospective studies at this point. It wouldn't be appropriate, but we are monitoring the outcomes. And the outcomes are much better for our vaccinated moms who do get COVID than the unvaccinated moms who don't. And we have too many COVID orphans in Mississippi, and we have COVID orphans all over this country. But these are issues we'll be talking about later. The babies growing up in Mississippi without their mothers. We have babies right now who've lost their mothers and their fathers, and then the amount of disability that we're going to be seeing from long COVID. These are all things that that the vaccination helps to protect us from. And so we are not seeing bad outcomes in our pregnant moms. We're not seeing any fertility differences between vaccinated and unvaccinated women or vaccinated and unvaccinated men. So right now, the OBs are recommending vaccination at all stages of pregnancy. And I have a pregnant daughter-in-law who I'm very proud is vaccinated and boosted and doing well. I know my granddaughter is safe.
And we need to, in addition to what Dr. Edney's saying, we need to remember that the women who are vaccinated do protect their babies also. So that's good to remember. And we know that the women who were not vaccinated, again, are the ones that are having so much problems with their pregnancies. They're having preterm babies, they're having more miscarriages, those kind of things. Those are facts. They are having preterm babies and more miscarriages if they are not vaccinated.
Thank you all. My youngest just turned 12 years old, but had COVID in December. Does he need vax, or is natural immunity enough?
Natural immunity is helpful, but they do need the vaccine. And we do recommend that anybody, regardless of prior infection, when you're eligible to get the vaccine, that's going to offer the best protection and the most long-term protection. And so we do recommend that individuals, even if they've been previously infected, do receive vaccine.
Let's see here. They are asking a lot about the side effects of the COVID shots, and we've talked about that. How do we reassure the public? We've talked about the research, we've talked about cases, we've talked about people who've survived, but quite a few of the questions are coming in and they're about the side effects.
Well, I think one of the things I'd like people to remember is this has been a very extensively tested vaccine. I mean, this vaccine has been in development since the beginning of 2020. In every phase, there have been clinical trials. In every phase, these, and then the vaccine has been used around the world. There've been over 1 billion doses given. Dr. Byers could probably tell me exactly how many, but that's a lot. I mean, that's more than you get with a lot of other vaccines. And we're just not really seeing a lot of side effects as far as side effects from the vaccines.
You know, it's kind of like I tell my children too, like they kind of felt a little flu-like after they got their vaccine, but that's their body kicking in and working and getting strong so that it can fight the virus when it's exposed to it. So, I mean, having a little mild side effects after the vaccines is actually a good sign that your body is making antibodies.
I had fatigue, I had chills, it put me down for about 36 hours. But I tell you, I'm happier having had the vaccine than I'll put up with that 36 hours of fatigue and achiness and chills and uncomfortableness in an effort to not be so adversely affected by this virus, nor put other individuals in harm's way because I'm not vaccinated. It was well worth it.
We are being advised that the vaccines do not prevent catching the virus, spreading the virus, nor catching the virus again. We are also advised it lessens the severity of the virus and severe outcomes. Doesn't that make it a therapeutic and not a vaccine?
No, and I see that Dr. Edney wants to talk to, and he's going to be more eloquent than I am. However, that is one of the benefits for many vaccines that we see, and when we talk about what is it we're trying to do with the vaccine, certainly prevention of transmission and prevention of illness and infection is an important part of that. And I think that the vaccines have demonstrated that they've done that. However, one of the bigger parts of vaccines is ultimately to provide that additional protection from those severe outcomes. And I think we see that very similarly with influenza vaccine, which often has an effectiveness at 50 to 60% at preventing infection, but especially in older people, is vastly superior at preventing hospitalizations and deaths. And again, we want to prevent transmission. That's why we want a layered approach. And the more people that we have vaccinated, that's where we get additional protection from community transmission. And then I'll be quiet and let Dr. Edney talk.
That's exactly what Dr. Byers said. And a therapeutic is something that we administer to actually treat the viral infection itself. And and I will tell you, we have a lot of folks who are getting very sick in the hospital and they're having trouble breathing, who are unvaccinated, who are then wanting to be vaccinated, but we cannot vaccinate at that point. You have to recover. So vaccination is for prevention, and it's still very good at preventing infection, but it's also very good for mitigating the bad outcomes as stated. But the therapeutics are the things that we administer once you are sick to try to help get you through it.
The next question is, when do you think the pandemic will switch to an endemic, and will yearly boosters similar to those targeting new variants of influenza, the influenza virus, every year become the new normal?
Well, the last part of that is maybe. I think we have to kind of see how things sort of progress over these next few months. Certainly, it is possible that we may be looking at more frequent boosters down the road, depending upon what the overall disease burden and transmission is, if we do make a transition to an endemic state. And it's hard to have a crystal ball to sort of project where we are going to be in the next few months as far as COVID. We're coming down off to the back end of Omicron now, and as I indicated, we will continue to see potentially lower levels of transmission over the coming few weeks. It's difficult to know if if and when we're going to have another increase in activity. I think it's likely that we will see some epidemic increases over the coming months, and certainly it's possible that that may be what we look like when we go into more of an endemic stage, is that we see transmission at lower levels with periodic increases in activity, either from seasonal effects or from changes in variants. And I think that what we see will ultimately dictate whether or not we need to have and whether there will be recommendations for boosters with some level of frequency down the road.
This question, can COVID be transmitted via surface or objects, or is it only respiratory?
Well, it can be, but that's not the highest risk. I mean, certainly we do recommend that folks clean surfaces, especially high touch areas. And we know that, there is a potential that you can touch a contaminated surface, and then by rubbing your nose or eyes or mouth, certainly you can be infected. But primarily this is transmitted through respiratory transmission. And that's how people are getting infected. And really that's what we see with higher levels of infectiousness in some of these variants as well.
Our next question, in terms of priorities, should our focus be on trying to convince or reach the 50% of Mississippians who are not yet vaccinated, or promoting boosters for those who have already shown a willingness to get vaccinated?
Yes. We have to do it all.
I think some people like to look at other places in the world where restrictions are being lifted in schools and communities, but in those places, especially in Europe, they have a extremely high, almost a 98% vaccination rate. That's how you get out of this.
Anyone else want to address this?
No, I just agree with Dr. Edney that really it's got to be multifocal. We want individuals who are eligible to get that booster. We know that that's the best protection, and we want individuals who've not yet initiated the vaccine to please do so. And then when it's time, get your booster. And I think that, as we continue to move forward, every percentage point that we get is going to be helpful for us.
A part of the reason that's so important is you want to work in a multifaceted way, is because for those individuals who are not vaccinated, they portend and maintain for the community a higher viral load availability. So that higher viral load availability allows for greater mutation, as others have said on the panel, allow for greater mutation over time. So you don't only want to focus on those individuals who are vaccinated and want them to get the booster, but you want to do your best to educate those individuals who are yet to be vaccinated about the science, so that they understand the longer they are not vaccinated, the greater the viral load exists in our community and the greater the propensity for mutation of this virus, because the ultimate goal of this virus is to survive.
The next question, what are the panelists' views on naturally acquired immunity? The science is clear that naturally acquired immunity is as good or better than the vaccine, yet it is not being recognized. And those who have had and overcome COVID are being coerced to get the vaccine.
Another thing about the vaccine, when you get the vaccine, you are actually bolstering your natural immunity. You're exposing your body to a portion of the spike on the virus that allows your own immune system to make its own antibodies against this virus. So it sort of supersizes your immune response, the vaccine does. So it is a portion of your natural response through this antigen.
And you have to remember that if we go the other respiratory corollary, which is influenza, I have seen patients who did not take their influenza vaccine get both influenza A and B, which are two different strains in 1 year. So just because you have some natural immunity, which is great. I mean, I think you can talk to Dr. Byers and Dr. Dobbs. They're glad that people have some natural immunity, but that doesn't completely protect you from the mutations and the changes in the virus.
You know, and Maggie, natural immunity does help towards having higher levels of community immunity, but it wanes. And in my experience, it's waning even faster than vaccinated neutralizing antibodies. So and also, but through natural immunity, if you were infected and recovered, God bless, we're grateful. But every person who gets COVID is assuming a risk of not recovering. And then those who do recover are having to deal with significant risk of long COVID disabilities. So that, you know, the science is clear. You can believe us or not, but the science is clear that vaccinated immunity is very effective. It's very safe. And, you know, if you have natural immunity, we're glad, but it's going to wane. And if you get infected again, like we're seeing a lot of reinfection with Omicron, then you're assuming more risk yet again through being infected. So I've been working hard 2 years not to get infected as I take care of COVID patients. You know, I'm sure I'm jinxing myself. I'll have it tomorrow, but you know, I choose to be vaccinated and go the safer route.
And actually quoting a conversation I had a while back with Dr. Edney, when you look at statistics, you go, oh, well, only 2 to 3% of Mississippians are dying from COVID. You know, what's the big deal? Why don't I just go get it? Well, first off, you don't want to be that 2 to 3%. And then, as my friend Dr. Edney said, because he was treating adults at the time that ended up being on a ventilator for a few weeks. If you spent a few weeks on a ventilator, your life is never going to be the same, even if you survive.
This is our next question, and for every panelist to answer, and we have about 8 minutes left. What are some as of yet unanswered questions, mysteries you still have about COVID-19? And I know that's a tough question.
Well, I'll go first, so I don't have to go last. But what in children, especially, again, you know, as Dr. Davis Sullivan said, this is a novel virus. Even though we've been at it for 2 years, there's still a lot we don't know about it. What we're seeing in children, and I can't speak to adults, but we're actually seeing an increase in diabetes in children who have had COVID. We're seeing something that's very rare, which is a Kawasaki's-like disease that's called MISC, multi-system immune syndrome of children, which is after you've had COVID, and some of these children didn't even know they had it. Then they get a horrendous illness where they have high fever for days. They require hospitalization. They require treatment. We're seeing an increase in that. We're seeing children who get COVID and can't go back to sports as quickly as they would have after a simple cold or the flu, who are, if they've been hospitalized, the recommendation is they have to see a cardiologist before they can even participate in sports. So I think the problem from the pediatrician standpoint is we don't even know where this is going to end. We don't know what's going to happen with these children in 5 or 10 years, what other things we're going to see. We do know that the vaccine has been tested and it's safe and that it prevents these things. The children who have been vaccinated have reduced incidence of MISC by over 90%. They're just not going to get it. So that's kind of my take on this is we still don't know what's out there, but we do know a way to minimize it.
And I'll just follow up on that too. The mystery for me is we do know that COVID affects the brain, and it's going to be interesting to see how it does affect the brain long term. I mean, we're seeing things with memory. I mean, we hear about COVID brain, COVID fog. We're seeing a lot of new onset psychosis. So it'll be really interesting to see long term what the effect this virus has had on our brains.
Anyone else?
Maggie, I'll tell you, I've been practicing medicine in small town Mississippi for over 30 years. I've never seen anything like this. There's nothing to compare it to. And when you talk to other doctors who actually fight this thing, they'll tell you the same thing. We have nothing to compare it to. It's its own thing. And every time we think we've got it figured out or it's about to calm down and we're going to get through this, it throws us a curveball. I've never dealt with anything as contagious as Omicron before. So this thing is a mystery in so many ways, but I'm grateful for what we do know. I'm going to tell you, 2 years ago, we were, physicians out in the communities were depending on Dr. Dobbs and Dr. Byers to teach us what to do, help us know what to do, because we had nothing and had never fought anything like this before. 2 years later, we have a lot of tools. We have vaccines that work. We have medications that work. We have hospitals that are under great stress and strain, but they have stood their ground and have remained open and have not collapsed. I know other industries would not have done as well as our hospitals have done. And, and one mystery, it's pulled public and private medicine together in a way that we've never seen, which is a great benefit. There's no way that I could be treating COVID patients without the information coming out of Dr. Byers' office on exactly what am I seeing, what kind of COVID am I dealing with, what medicines will work. So a lot of mysteries, a lot of unanswered questions, but thankfully a lot of questions are being answered. It's better than it was.
Following up on what Dr. Edney has said about the ability for our healthcare system to hold up against all of this onslaught, I think my question would be, what's going to be the permanent impact on our healthcare system, whether that's recruitment into our healthcare professions, nursing, medical, and others, and ultimately, then will there be a new way of providing care for Mississippians, and will there be less infrastructure for the next crisis that comes along? So I think those are the unknowns, certainly for me. And
I want to thank everybody, first of all, for being on this panel and certainly giving your time and your information. And I learn a lot every time I listen to y'all talk. I think, for us from an epidemiological standpoint, many of the unknowns are pretty much where do we go from here with this virus and what are we going to be dealing with in the next few months. What can we predict? And I think we can predict some things, but what does the next variant hold for us? What is, if there is another variant, and where will we be down the road? And those are the things we work to predict, not only the short-term disease transmission and impact, but where do we need to go long-term? What's it going to look like? And what are the surveillance systems that we need to develop to continue to keep up with the disease burden and the transmission? And so we've learned a lot. I think the next few months will reveal more.
And that brings us to what will probably be our last questions. What are the panelists' opinion on the new BA.2 strain of Omicron that is now circulating in Europe, that is more infectious than the BA.1 strain that we are currently dealing with? Do you think that this will become the new dominant strain?
Well, it's possible. We've identified one case so far in Mississippi. We haven't seen rapid transmission of this particular BA.2 subvariant in Mississippi so far. Certainly, it has looked like it is more infectious in some of those countries where it's becoming the predominant strain. It's one of those things that we're watching. And we talked about earlier that we do our routine surveillance to look for emerging variants or different variants. And it is one of those things that we will continue to watch. I think there's more that we need to learn about it. It does not appear to be causing a more severe infection than the current Omicron. I think one of the concerns that we watch is the potential for what impact it may have on some of the available therapeutics and how well they work. And I think we will learn more. But right now, we continue to look for this subvariant in Mississippi.
Quickly, this question: does the panel continue to support hospital policies that separate COVID individuals from their families? In most cases, the family member has already been exposed at home or driving that family member to the hospital. These policies seem to exacerbate the mental health struggles of the patient and their family by separating them.
So I'm happy to take that question. Right now, our hospitals are not, they are not indicating that patients cannot have any visitors. Some have visitors up to 4, they have to be the same visitors. But some of this is not just about obviously protecting just that patient, that family member. It's about protecting everyone else that they might come in contact with around the hospital. And so the policies are not set up to be as restrictive as possible. They're set up to be as safe as possible.
Well, thank you all very much. That is all the time we have. I want to emphasize we got quite a few questions. If you have a question that was not answered, you can, and you require more information, you can submit it at www.thecapitalmsway.com. Again, that's www.themsway.com. I'd like to thank all of our panelists for the information that you've shared with us today and for answering questions. Dr. Daniel Edney, Dr. Paul Byers, Dr. Jerry Weiland, Dr. Catherine Panel, Dr. Kim Hoover, and Dr. Hersey Davis Sullivan. And also thanks to the Mississippi State Medical Association for sponsoring this COVID-19 town hall meeting today. Thank you all very much. Have a blessed rest of the evening. And again, thank you for taking care of Mississippians.
We want to thank you for doing such a
Thank
great
you.
job.
Yes, thank you, Maggie.
Thank you
Thank you.
so much.
Thank you, Maggie.
Thank you so much.